Go.
Good afternoon, everyone. It may seem odd to be describing a new case as good news, but in our latest case, there is good news. Case number 6 is a person from the Whitehorse area who returned as a traveler from Europe within the last 2 weeks. And this individual was already observing self-isolation measures as required prior to onset of symptoms and is doing well in isolation at home. There are some family contacts who are now observing self-isolation as a precaution. All of our cases continue to do well. None has needed medical intervention or support. In fact, 3 of the cases are now fully recovered and have completed their isolation periods. So we're pleased to be able to add the recovered category to our 3 times a week case update on the Yukon COVID website. And we remain therefore in a good position with no cases outside Whitehorse and all cases doing well. Just a little summary in French. Il faut dire qu'il y a beaucoup d'éléments positifs entourant un 6e cas. Il s'agit d'une personne de Whitehorse qui est revenue d'un voyage en Europe au cours des 2 dernières semaines. Cette personne respectait comme il se doit les mesures d'auto-isolement bien avant l'apparition des symptômes et à ce moment poursuit son isolement à la maison et se porte bien. De proches de la personne se sont également placés en isolement préventif. D'ailleurs, 3 de ces personnes sont maintenant complètement rétablies et ont terminé leur période d'isolement. I know there are many questions remaining about how we are operationalizing some of the recent orders, particularly with regard to people arriving in Yukon from outside the territory. More details will be coming soon, including definitions about where exceptions to self-isolation can be applied. I want to emphasize at this point that where exceptions to self-isolation are considered, the expectation is still self-isolation for these people when they're not at work. Rigorous self-monitoring for symptoms with strict adherence to physical distancing will be required. Self-isolation is otherwise the default expectation for all other workers, including mining camp workers, so that communities can be assured that incoming workers are free of COVID virus. So I just wanted to move beyond that perception of there being an exemption. The self-isolation requirement when there are exceptions is under supervision, under risk assessment, is not an exemption, but has strict self-monitoring requirements that go along with it. And that's for us to be able to continue with critical infrastructure work when required. So details of who is in that category and who is not will be coming shortly in the next few days. As mentioned on today's written announcements, work camp guidelines have now been issued for work camps during this pandemic period. These guidelines include instructions on how to practice safe spacing and other preventive measures at the camp, a guide to food handling, instructions for how to self-isolate at camp if required due to symptoms or in case of contact. And thanks to our friends at Air North, greeters are now in place at the Whitehorse Airport for any arriving airline to ensure travelers are aware of the 14-day isolation requirement and to otherwise ensure that they have the information and support that they need. Passengers are also receiving guidance before they deplane, and COVID-19 information is displayed on airport screens. There have also been lots of questions about what arrangements are in place at the Whitehorse Emergency Shelter. Staff there have been working intensively on adapting the shelter to today's COVID realities. Continuing to support vulnerable people and help to prevent COVID from affecting them is one of our key priorities. Some of the activities include reducing the number of people in the shelter at any one time, actively screening guests for symptoms, providing access to testing where necessary, additional cleaning measures, ensuring accommodation for people who need to self-isolate. I'd also like to salute the many non-governmental organizations who are continuing to provide much needed services and support, as well to people who are either homeless or at risk for homelessness, while adopting all of the required safety measures to minimize COVID's threat. And it's a short update today. That's all I have to offer for now, but I'll be happy to answer questions as best I can.
Okay, if we can take the question in the room first, and then we'll go to the phone lines.
Julian Janak, the Narwhal. I just wanted to ask about these exceptions. You mentioned miners flying in, 14-day isolation period before they can go to the mine. Is that deemed an exception to what could be enforcement of 14-day self-isolation?
For the mines, we have set a bar, and that bar is 14 days of self-isolation before going into the work camps.
And is that an enforcement? Is that being enforced?
Yes, that is okay. That is being monitored and enforced.
Okay, and the other question I had was Eagle Gold has 190 people working at that site. Currently, there's I think 10 people, no more than 10 people in terms of gatherings. Why doesn't that 10-person rule apply there?
So it's a good question, and it's about gatherings and in this case a mine, but can be generally applied to workplaces. So how does that figure of 10 apply to workplaces? And the gatherings is applied to what we call mass gatherings or social gatherings. So within a workplace, there may well be in a large workspace more than 10, even more than 50 or more people, and it really depends on what the key concern is spacing. So social gatherings are limited to 10 as a blanket public ban to avoid some of those encounters that we find in social gatherings, whether it's spacing that's less than 2 meters, whether it's hugs, whether it's sharing of food, many risk factors that can be associated with social gatherings. If you have a workplace that's large enough with adequate spacing and you follow the physical distancing rules, then that is not a mass gathering. It's another setting.
Gord at the Yukon News.
Yes, I was wondering if you could clarify what exactly you mean by recovered. Does this mean their virus is gone from their system and they would no longer be contagious and be able to pass on the virus?
So the question is about what does recovered actually mean? And we do actually have a definition of recovered. First of all, it means that the person has to be asymptomatic and have no more symptoms and have been a minimum of 14 days in isolation. So once they have cleared their symptoms and finished their time of isolation, then they are no longer infectious. And there are exceptions. So the exceptions are for instance, hospitalized patients. There are also special considerations for those who work in healthcare settings. But for the purposes of the people that have now been declared recovered, they are symptom-free and they have finished their self-isolation period.
Thank you.
Chris, CBC.
Yeah, hi. Just wondering if Dr. Hanley had any information about whether the NWT's second case that was announced today and is in Inuvik, do we know if that person traveled through Whitehorse to get to Inuvik?
My understanding from Dr. Kendall's announcement of that case is that the person took a flight back to Inuvik. The flight details were not published. but the person did not have symptoms until 5 days after the flight. So even with a very conservative approach to flight contact tracing, regardless of the route of the flight, it would be irrelevant whether that person flew through a Yukon route or through an alternative route to get to Inuvik.
Okay. And my second question is, how much work has your office done to sort of, I guess, build a model to try and examine how serious this outbreak is going to be in the Yukon?
The question is about modeling and how much modeling is being done locally. It's a really good question. We do actually have a small modeling team, and we work very closely with colleagues in British Columbia as well as national counterparts. There are clearly limitations to modeling on our small population, so often it's a matter of projecting modeling exercises in other jurisdictions onto some of our what we know about our own demographics. So yes, we are modeling. We don't have as yet anything to publish on the modeling studies. We will update you as we progress further enough in the modeling to give meaningful public information. But it does allow us another way to look at a number of different scenarios or possible scenarios while we put all of the preparations into place, whether that's ramping up public health capacity, whether it's public measures and the possible impact, or whether it's preparing for surges in demand on our healthcare facilities.
Aurore Boreal. We'll come back. Claudiane? Okay, well, while we're trying to figure out where those folks are, we do have a text question from Gabrielle at the Whitehorse Star. If someone at the shelter needs to self-isolate, will they be moved to the isolation center at the High Country?
The question about self-isolation. So there are special provisions being put in place for shelter. So there are actually some special arrangements being made, including rooms at the shelter where self-isolation can occur. So it will depend on the circumstances of that individual person, depending on their own circumstances and our ability to follow up with that person. So depending on the needs and the circumstances around that person, it could be a number of settings. Those who are certainly more vulnerable, that need more intense support, would be housed at the shelter itself.
Okay, she has one follow-up question. If someone with an addiction is asked to self-isolate, will supports be put in place to ensure someone is not going through withdrawal while in isolation?
Yes.
That was easy. Can we go back to the phone lines? Do we have Aurore Boreal?
Yes. Ma question, il y a beaucoup de personnes que je connais qui s'inquiètent de la frontière de l'Alaska et à quel moment pour être derrière la frontière.
I'm sorry, you're breaking up very badly. We can't get the question.
Maybe it's better now.
Yes.
C'est une question au sujet de la frontière. Beaucoup de Yukonais s'inquiètent au sujet de la frontière entre le Yukon et l'Alaska. À quel moment le docteur Hanley pourrait décider de fermer la frontière?
C'est une question de la frontière entre Alaska et Canada. Et this is a question about the border between Alaska and Canada. So that is a federal matter, and as you know, there are already restrictions in place for non-essential travel between the U.S. and Canada, which also apply to Alaska. Donc c'est sous les règlements fédéraux, et comme vous savez, il y a déjà des règlements en place pour limiter la circulation de trafic, de mouvement entre les frontières entre Alaska et les États-Unis et le Canada, incluant le cas de Alaska-Yukon.
Claudiane?
I'm good, thank you.
She's good. Are there any other questions on the line?
Yes, it's Tim from CKRW. I have a question.
Sorry, go ahead, Tim.
Dr. Hanley, I'm just wondering, with stepped up announcements regarding PPEs across the country, the federal government had said that 500 ventilators would be able to be delivered across Canada in early April. We've seen the donation of masks from Suncor Energy as well on the weekend. But I guess, what is Yukon's kind of piece of the equipment? Are you, getting, for lack of a better term, getting your hand in there and trying to get some of that equipment here to the territory?
Question about getting PPE, ventilators, other supplies from federal sources. So yes, absolutely. We're in very active, very intense discussions with the federal government and with our counterparts, also with our northern counterparts, on acquiring supplies through the current federal bulk purchase, as well as various other arrangements. So we have centralized acquisition of PPE now, which includes the hospitals and health and social services, and as well as being able to supply where needed for community needs. So we now have a centralized process. We're developing guidelines for use of PPE in various settings, whether community settings or acute healthcare settings. At the moment, we feel very confident about our role and our ability to get our fair share, as it were, of PPE. Ventilators is another process, but there is a separate process for ventilators. As you know, it's not just a matter of ventilators, it's about the whole critical care capacity, including staff, including oxygen supply, including the consumables associated with ventilators. So, and again, another very, very active area of search planning. And again, a reminder that the biggest saver on critical care need will be the public health measures. So by limiting the spread of COVID, by dampening down, flattening that curve as much as we can, that is going to be our biggest answer to critical care needs. At the same time, we're making all of those preparations based on various scenarios.
We have time for
Just
two.
a quick follow-up.
Okay. Go ahead, Tim. Sorry.
Sourcing any other areas? Okay, sorry. Are you sourcing any other areas other than the High Country Inn, like for potential space?
There are. I can't give you details on that, Tim. It's a little out of my arm's length, but I know that there are active discussions for alternative places should the High Country reach capacity.
Thank you.
Okay. Julian, you had a question?
Okay, so no spread in the communities yet. Are you concerned at this point about possible community spread or community members being infected by COVID?
So the question is, am I concerned? So I'm going to interpret that as, do I worry about community spread? Yes, I mean that our aim is to stop community spread at its source, But I am confident that we do not have community spread at the moment. So, and the way that we are looking for it and anticipating it is by aggressive testing, by having even more focused testing in rural areas, and in carrying out that active surveillance, as well as preparing our communities with active conversations with our communities, as well as our community health nurses, so that all are confident that should there be a case that appears in the community, that we can contain that case equally well in a community as in Whitehorse. So the appearance, of course, when I say community spread, I just want to be clear on what that means. That means that spread wherever in Yukon would be from one person to another without it being associated with a travel imported case, and we're not at that point yet. So that's different from a case appearing in the communities, which, although all of our cases so far have been in the Whitehorse area, it's just as possible that we would have a travel associated case appearing in a community, but that our strategy would still in that case be just like we're doing now, containment, self-isolation. And so that would not in itself indicate necessarily any change in public risk or community transmission.
We have time for one more question. Does anyone on the line have one? Hearing nothing. Thank you very much, folks.